Good evening, everyone. Today we'll be discussing history taking counseling of a patient who is presenting in mania. For patients in mania, we would like to follow this very simple structure. The first step, like every other station for NAC OSCE, would be your introduction and setting the stage with the patient, making sure they are comfortable, reassuring them of privacy, etc. How you can do it depends upon your own approach. How we recommend is to introduce yourself. Hello again, my name is Fayaz, or I'm Fayaz, or I'm Dr. A, Dr. B, Dr. Z, etc. And I'm here to talk to you about your condition or your disorder or your disease in case they have been given the diagnosis. If not, you would approach them with other methods of building the rapport. For example, you can say, I'm here to talk to you about your conditions, talk to you about your symptoms and the disorder or the disease we think may be causing these symptoms. Are you okay right now? Or do you feel comfortable enough to talk right now? Since they're standardized patient in the exam, they will respond with yes or sure, however they prefer. Now, before you start dumping your knowledge onto them, make sure you just ask them simply, what's your understanding of your conditions? Or what is your understanding of bipolar disorder? Or what is your understanding of mania? Just this one simple question will save you a lot of time and organize how you move ahead with your station. You ask them, they say, I feel energized and seeing clearly, etc. Here you can read, I feel like I'm just energized and feeling finally seeing clearly. Others think I'm crazy. Now you can show some empathy here, or you can just go ahead and answer them like, I understand you, I see, I hear you. I'm sorry to hear that others are calling you crazy, etc. Any sentence that you feel comfortable and can bring up spontaneously without having to think about it. Make sure you have 2, 3 sentences to show empathy. Do not repeat, I'm sorry, I'm sorry, I'm sorry. And do not repeat, I understand, I understand, I understand. Just keep changing it over and over again and make sure that your speech is fluent and sentences that you use match the person's sentence or statement that they made just before you started talking. For example, here you can say, I hear you, I see, I understand. I'm sorry, or you can say, it must be hard feeling people calling you crazy while you just feel energized, and then go ahead and explain why this is unusual or why people are worried about them. So don't negate their point, just add on some information to kind of guide them towards the right side. Don't go directly across them, like don't cross them directly, don't tell them no, you're wrong. Just try to gently move them or guide them towards the correct idea or correct understanding. Now, once you confirm their understanding, let's say they know nothing about it, so you just base your whole station on that patient doesn't know, how you give them the diagnosis. So you start with based on your symptoms or based on what you have shared with us. For example, you were not sleeping, you had racing thoughts, you were impulsive, feeling overly confident. We believe you're experiencing a manic episode, or we believe you have bipolar disorder, or any other condition. You can still apply this structure to that. And then wait for them, or you can continue a bit more. Make sure between giving patient information and asking them how they are waiting for their response. And in between their information, you're cutting, make sure you're cutting the information to short uh, sentences and asking patient if they are following you, they understand what you said, if that makes sense to them. Don't just dump all the information that you have, because as a doctor, you have like uh, 30, 40 paragraphs of knowledge about bipolar. You don't want patient to listen to you talking about bipolar for 15 or 10 minutes. Give them a short passage. For example, the first thing you do is give them diagnosis and the symptoms, and then you ask them, Was it similar to what you experienced? And they would say yes or no, whatever. Then gently or shortly explain the diagnosis. For example, bipolar 1 disorder is a condition in which patient feels their fluctuations in mood from very low mood to very high mood. Simple and straight. Don't go over beating around the bush. Just keep it simple, very simple. Don't really need to do much explaining. Just give them the short definition and tell them about a few symptoms that they have discussed, or if you know what symptoms are the most common ones, just discuss the most common ones and move on. Don't waste too much time on explaining what bipolar is, and then ask them, does that make sense to you? Are you following me? Are you following with me? Are you does that make sense to you? Are you are you following what we just discussed? Things like sentences like that, to make sure that they are following you, following your speech, not following you physically. Sorry, that would be horrible if a patient is following you. And keep checking their understanding of the information you're giving them. Don't give them too much information at once. Break it down. Simple sentences. Patient may say, I don't feel sick. What your response should be natural. Make sure you have the natural responses to different sentences. Patients can uh, say a sentence that may feel aggressive. In a real exam, they won't give you a patient in acute psychosis, since it's very hard to mimic. But again, you can never be too sure. Just make sure what you respond with is how you naturally would speak, and it is not rude. It is neutral language, patient-centered, and not something that is aggressive or can be interpreted as aggression or insult towards the patient. Once you give them the diagnosis, and you ask them uh, about if that's how they were feeling, they would say yes or no. Then wait for them to ask you a question. If not, you can wait for a few seconds and then start. It is a very treatable condition. It's a treatable condition. In case it was something that was not treatable, in those cases, you won't say it's a treatable condition or you will be fine. Um, do not give patient false hope. Give them correct information, sympathetically or empathetically, and make sure that you do not give them something that would not happen. For example, if you're talking to a stage 4 cancer patient, don't tell them they will be all right. It's very unlikely that they would get all right from that. In this case, it's bipolar, which is very treatable, and many people have good response with just lithium for a long time. How you would approach someone with bipolar? I want to reassure you, I want to assure you, I want to let you know, I want to explain to you that it's very treatable, and people with bipolar have very successful lives. The only thing is that we need you to take your medication, and we are not going to punish you or do something that would harm you. We just want to make sure you are safe and everyone around you are safe. It's done. So you're done with the diagnosis part. Come to the treatment part. Um, Treatment, you can start directly, as in here. Right now, you're in an acute manic state, and treatment is needed to help your mind settle. Or you can ask them, are you aware of what treatment options we have? Or you can let them ask you if they are talkative, or some patients would ask you, so what do we do about it? If they ask you, well and good, just say, we will do some lab work to make sure we are ruling out causes, organic causes for your symptoms, and then start you on medications. Now, for bipolar, first line is lithium. If lithium is contraindicated, then we consider other medications, lamotrigine, valproic acid, any other mood stabilizer. But in manic episode, you have to give antipsychotic plus lithium. Lithium is going to take about a week or two to start acting and stabilizing the mood. You have to bring the mood to normal acutely, which is by antipsychotics, quetiapine, olanzapine. It depends on how the patient's profile is. All right, now you give them the treatment option. We will start you on mood stabilizer and an antipsychotic. to help bring your mood to normal. And then once your mood is stable, we will send you back home with the lithium, and we want you to take it every day. If that once that's done, patient may follow up with, is there any side effects from the medication? If you know the side effects, explain to them. If you're not, just reassure them. Don't give them false reassurance. Just let them know, yes, medications do have side effects. However, the benefit of taking them outweighs the risk of not taking them. And the goal right now would be to make sure your mood is stable and you're safe. Um, if you have any other questions, I will have the nurse or the support worker give you information on the medication we are starting you in written form so that you can read it. Uh, Once that's done, come to the final part. Um, Recap, or how I do it is I recap it and then let them know. For example, I say, uh, so based on your symptoms, I think you, or I believe you may have something we call bipolar disorder. We will run some lab works for you and start you on two medications right now. One medicine is an antipsychotic, quetiapine, that would help in in bringing your mood to normal quickly. The other medicine is lithium that you would have to take for a long term. Um, I recommend that you take it every day at the same time. Is that something that you would be willing or you would be able to do for me? And then let's recap plus medication adherence advice. So you're just making sure patient is following along with you. Once that's done, you can say, okay, that's all from mine. Do you have any other questions? They may ask you questions. If not, and you're not out of time, you can just have a seat and stay seated. Do not move, do not talk. And that's pretty much how you approach a station with someone who is coming up with mania. Now, if you have more time, go ahead and discuss lifestyle changes for them. There are social support services, a lot of other institutions that can help them if they have concurrent addictions or substance use or anything with it. You can address those and ask the patient to contact them. Oh, sorry, not ask the patient. You can introduce or refer the patient to those mental health services so that they can follow him up in the community. Finally, you have done everything. You're just leaving. Just say thank you, and that's all done. Now, remember for NAC OSCE, a quick summary of how to do counseling. First, introduce yourself, confirm patient is comfortable, and obtain consent. You can do it in a variety of ways. I just bundle them up in one sentence. My name is Fayaz. I'm here to talk to you about your condition and discuss treatment options with you. Is that okay with you? And they usually, the response would be yes, since we are practicing, it's not real life. In real life, maybe patients say, oh no, I want another doctor or something, but that's real life. In exam, that's how it's going to go. Once done, I just simply give them the diagnosis. Based on your presentation and what we know right now, you may have something we call bipolar disorder, and your current symptoms are explained by a manic episode or manic phase. In this phase, someone suffering from this condition in manic phase would feel high on energy, very less need for sleep. They will be energetic, confident, taking risk taking, impulsive, have a lot of ideas running in their mind. And then I usually add the sentence, was that something you were experiencing? Um, just to make sure that patient knows that I'm talking about their condition and I know what I'm talking about. Once that's done, you have to destigmatize or make sure the patient does not feel ashamed of their condition. In most cases, they may say, oh, am I crazy? Reassure them, no. You can say we do not have a word crazy in medicine or insane in medicine. Just reassure them it's a mental condition, mental health condition, just like physical health. Sometimes it can happen, and with medication, it has very good prognosis. People have very normal lives once they are stable on their medications. Now, once the once the diagnosis is given, you have given them some reassurance. Start explaining treatment, what you are going to start them on, why it's necessary. Again, then offer them hope, work on long-term plans, and at the end, make sure you are mentioning medication adherence. It's very important. Some patients, especially in mental health, they start the medication, they start feeling good, they stop the medication, they become worse. So make sure um, you're explaining to the patient why it's important that they take their medication every day at the same time. Um, Finally, you can discuss other safety measures such as hospitalization, etc., depending on how the patient is presenting. I hope helps.